I had a great conversation with two therapists, Lisa Marciano and Stella O'Malley. In this first part of our conversation, we talk all about therapy and what makes it effective and what makes it a real relationship between two people. We discuss some of the ways that focusing on diagnoses and symptoms and strategies can be helpful in some cases, and in other cases make it challenging to get to know the client as a real person. We also look at some of the specifics of working with adolescents and trying to honor the individuation process while being careful not to drive a wedge between teenagers and their families. Here's our conversation. Hi, ladies.
Hi, Sasha.
Hi there. So I wanted to get us together today to talk a little bit about therapy. We know that there are some misconceptions and some eagerness for parents to find the right therapist for their child. So I thought we could just talk a little bit about all of the complexity around this topic.
Well, I'm glad you are having us do this, Sasha, because I think it will be really helpful for lots of people.
Mm-hmm. So maybe we can start with, very generally, what makes therapy effective? What do we know about effective forms of therapy?
Well, first of all, we do know that it's effective. I mean, there's been a lot of research that has shown that talk therapy works. And, in particular, I'm very interested to note that psychodynamic talk therapy works. So that's therapy that usually has a slightly longer course that isn't a kind of manualized therapy the way that cognitive behavioral therapy can be sometimes, but it's just based on an open-ended dialogue between the therapist and the patient.
I'm integrative, and I'm not psychodynamic in the strict sense of the word. And I'm very interested in the differences of therapy and how, for example, CBT, cognitive behavioral therapy, has become so strategy laden that it has, and I've studied it, that it's almost like parents and clients might ring me up saying, give me the strategies and give me them quick. And how soon can I get the strategy? When are you going to bring out the strategies? As if they're on a tray or something. And I'm going to bring in the strategies. And I feel I'm fighting a continuous and long-term battle of, I could give you lots of jargon and I could give you a lot of expectation around a certain strategy and stuff, but actually there's a longer, more complicated, probably less exciting way to go, and that's just to get to know yourself and to get to accept yourself and forgive yourself and like yourself. That doesn't have bells and whistles, but it's actually a truer road. And I think that's effective. I think everything about all the writing for thousands of years, way beyond psychology, has proved, know yourself.
Yes.
That'll get you through.
And I wonder if both of these types of therapies that you're talking about, because they're not manualized, because they're not so goal-oriented, they allow the therapist to take their time with the client. And it leaves that space open for actually getting to know who you're dealing with, because you're not coming in with as many preconceived notions, the way more of a very kind of specific form of therapy works, like a CBT or a DBT. Though they can be effective for some things, there are some underlying assumptions that the therapist is making about what the presentation means. And I'm also thinking about all of this research that shows the client perceives therapy to have been helpful when the relationship is really good with their therapist. And sometimes working through a manual or a protocol actually makes it hard to get to know the person as an individual.
Yeah, that's a really good point. As far as I understand the research, the relationship is the variable that makes a difference. So it really doesn't even matter where the therapist went to school or what kind of philosophy that he or she prescribes to. It's really just the relationship. And if it's a good relationship and there's a connection and a sense of fit and attunement, the therapy is often perceived to be effective, and effective in the long term as well.
You know that, though. You know that as a therapist, when you connect with your client, we're in. we're here, we're going somewhere, and we both know it. And then when you don't connect so easy with it, I as a therapist feel a lot more uneasy, thinking I haven't quite connected. Everything else, I might be throwing strategies at this, but actually it's almost a sign of my lack of confidence in the relationship. And I would say I put probably more effort into the ones where there's lack of connection. That could be, in its complicated way, be getting in the way of the freedom of just connection. Is everything. For me, it's everything. And it's definitely the biggest thing I bring to the table working with clients.
So there are a couple of corollaries that come from that. One is that the person coming into therapy has to be open to that connection. So that's why mandated treatment really rarely works, because if you're forced to go into therapy, say, for anger management classes because you've been in some violent incidents and the court has mandated this, it's usually not very effective because you're not going to be open to connecting with the therapist.
I don't know. I've often had teenagers come in and they're furious that they're there. And I feel I've got somewhere.
Okay.
Does the research make a liar out of me?
I'm sure not. No.
Well, I wonder if the resistance you're talking about, Stella, with teenagers maybe just comes with the territory of being an adolescent. And so you're able to break through that by being genuine and authentic. Like, I think teenagers really seek out authenticity in other people. So from knowing you, I would imagine your clients feel that you're pretty authentic as well.
Yeah. Mm-hmm. Yeah. Sorry, I cut in on you, Lisa.
No, that's okay. I was just going to say the other thing is that because we're talking about this kind of open-ended process that's really based in the client-therapist relationship, it isn't like we can treat one discrete thing and we are going to guarantee you that that will be fixed, right? Sometimes you do this work and really surprising things happen. It takes a turn you didn't expect, and there may be changes that are positive, but it could still be that the main thing you came in with didn't change. Yeah. So there's an unpredictability about it too. We can't guarantee anything.
Mm-hmm. Mm-hmm. Yeah, I think that's a valuable thing for anybody to keep in mind who's either seeking therapy or seeking therapy for a loved one, is that it's impossible to isolate a specific life problem and have the person resolve it without taking into context that they are a whole being and that every aspect of their life is interrelated. I'm also just thinking about working with patients who are in distress. I think one challenge in therapy is to find a balance between acknowledging and being with the person with all of their distress and their angst, and then also avoiding a co-rumination process where you are just kind of amplifying their distress. And so there needs to be a place for both recognizing it and holding it with them, and then also lifting up like new possibilities to come out of that. So I wonder if you guys have thoughts on that.
I think that's a great point, and it's a line that I'm often aware of in my work, because sometimes what people need is they just need to know that you're with them in their pain and that you really, really feel it. And sometimes they need you to point the way out of it. And if you try to point the way out of it when they're in the middle of it, that can feel really insensitive and it feels like you're shutting them down. And also sometimes when they're in the middle of it and you don't offer a different perspective or a way to relate to that distress in a slightly different way, they can feel abandoned. Mm. So I think that is a clinical point that's very easy to get wrong sometimes. But I want to just lift up the co-rumination aspect, because I think that this is something that people in the mental health field, sometimes we do this without realizing it, is someone brings us a problem and we treat it as if it's totally real rather than holding it in a sort of larger sense. And I'm not saying that we would ever doubt what someone tells us. We would receive it. We would acknowledge that it's important to them. And we might also hold it in such a way that at least we know that there might be a different way of relating to that problem. And I think sometimes when someone comes in with a presenting problem, the problem, like I'm here because I hate my boss. If we only focus on how much they hate their boss, we might be missing the larger issue. And it's our job to hold the larger issue, where if we just kind of go with them down that ruminatory road, we might be helping them get worse, not better.
That is such a good point. And it's so easy to fall in because certainly I am, busy empathizing and busy connecting. And so easy to be led then to wherever the client might want to lead you. And yet, if you're really doing good work, you need to say, yeah, I'll be led here, but I will also remember there's another bigger picture. And so you have to go into the woods where they lead you and also remember there are other woods. There are other woods. I'm going into this one, but there are other woods. And it can be very easy to fall into it. And it's our job, I suppose. And that's where reflection outside the therapy session comes into play, where you actually realize I fell in completely, and it worked because I needed to empathize, I needed to connect, I needed to go in there. But now I'm out of it, I realize, whoa, we went in somewhere as if this was the be all and end all, and there's actually bigger and wider things to kind of touch upon. I do think that it's a really difficult and probably the best, and I find the most intriguing challenge of therapy, which is you have to connect and you do have to bring, and now what are we going to do about it? If you bring that in too quickly, you lose everything. And you can feel dismissive and cold and so that's our job, to kind of not move it too quickly, but to move it there. And that's the one I'm kind of impatient by nature, and that's the thing I have to hold myself back on. Because if you go too quickly to, well, where are we going with this? You lose your client. You lose the connection.
I'm thinking about how much containment of our own emotions it requires to do exactly that, Stella, because when we have maybe some sort of a clinical impression of what we think is going on, and maybe we can see what we believe to be the way out, sometimes you have to know, I mean, it's an intuition of when the client's not ready to go there with you. And I think that is something you can, well, I'll speak for myself. I didn't always have that intuition. It takes practice, and it takes being kind of radically open to what happens in therapy when you push too fast, too soon, or when you make an interpretation when the client's not ready. So I think it requires some experience and intuition and self-regulation to do what you're talking about.
Yeah, and respect for timing. You could have the most amazing piece of psychology and you could have figured it out. You get the timing wrong and it collapses.
Yeah, but I just have to say, like, we will get the timing wrong. We will make mistakes. And that's part of it too, right? That we make mistakes, but hopefully we can also then repair it and we can talk about what happened. And that's actually part of the therapy. Yeah. Because then the patient learns that it's possible to be in a relationship with someone who is well-intentioned and who makes mistakes, and then there can be a repair. So it's that kind of serve and return thing that happens in an attachment bond.
Mm-hmm. Lisa, you're talking about the fact that the dynamics that develop between patient and therapist are human relational dynamics. It's not some bizarre kind of vacuum where we have this interaction that doesn't reflect the interactions we'd have with others. So you're talking about these really basic things that if you care for someone and you have done something that damages the relationship, you fess up to it and find a way forward and repair. So that's an important thing that I think sometimes working with adolescents, parents may contact me and people don't always understand that really what's happening between therapist and client, it's a human relationship.
Yeah, I will say sometimes, like, this is a real relationship. It may be a strange relationship, but it's a real relationship. And I'm just as invested as I would be in any other relationship.
And I often think that's I would say a big challenge I find is that in a way psychology and psychotherapy has set itself up as the Wizard of Oz behind the green curtain. And we're doing our voodoo in here. I'll say goodbye to you, parent. and I won't tell you what's going on. And it's an on-high feeling, and I'm doing my magic in here, and you won't ask me. And that can create an expectation, and you almost become godlike, and it's really uncomfortable within the family. And it's not really appropriate, because the entire concept is that the right therapist will help you help yourself, and will make you realize how incredibly difficult it is to help yourself. And it'll be really, really, really hard. That will be your big revelation behind this curtain, as opposed to, I'm going to do some potions here. I think there's too much invested, very much these days, too much invested in the therapy, and not enough invested in the day-to-day. Let's try and figure ourselves out here between sessions.
And I just want to say, though, when parents have a kid who's in acute distress or doing something dangerous or seriously going off the rails, parents can feel so fearful, so terrified, that they're really vulnerable to wanting to place all of their hopes in one magical person who's going to work, behind the curtain, right?
Mm-hmm.
So I don't work with adolescents, but I have had parents consult with me about their adolescence, and I can feel the weight of that expectation. Please tell me what to do to save my kid. I mean, when your kid is doing something dangerous, you are so terrified, and you would do just about anything. If you felt that someone had the answer, you would, open up a vein for that person to get them to help your kid.
Yeah.
It gives me chills to think about, because it is an entirely terrifying process for parents. And I think that is another reason why ethical therapy is so important, because sometimes therapists we find ourselves in these positions where a family might invest a lot of their trust into what we're doing. So maybe we can come back to this, but talk a little bit about what are some of the kind of ethical guidelines and informed consent processes that are meant to protect the client and their family from something going awry in the therapy process.
Well, I'll go in first, and you can come in after. Lisa, I would say you have to feel that you are involved and in control, and there isn't this case of magic going on unbeknownst to you. So the kind of a feeling like this is a reasonable scenario that makes sense in the realms of human interaction. So the appointments will be on time. You can expect the appointments to be a reasonable fee. You can have a certain expectation of a certain give and take around life and holidays and whatever, and that there's a certain reasonableness to it that I sometimes have seen perhaps clients give their power away and say it's as if, well, he said this is the way it's done, and I haven't got a degree in this, so I'm gathering this is how it's done. It's like, well, if it's not in the realms of how you have reasonably behaved everywhere else in life, well, that's a red flag for me.
Right. If it doesn't smell right, it's probably not right. Right. If something seems off about it, or there's a high pressure pitch, that should always make us nervous. I think, Stella, one of the things that you were talking about is this idea of the frame, which is so important in therapy. So usually, we establish regular appointment times. Hopefully it's maybe the same day every week. And, there's an agreement about how much you'll pay, and it's upfront like that. How will billing work? Everything is kind of laid out up front. And I feel very strongly that people should be able to leave therapy whenever they like, rather than having to commit to it in advance. I mean, I do think it's good if we can talk about it before people leave, have a discussion maybe. But to demand that someone commit to a set block of time at the outset would be something that would give me pause.
Well, let's talk a little bit about why that is so important for clients to be able to leave therapy? I mean, this is something very challenging because when you're really invested in a relationship with a client, you want them to stay connected, even if there are, let's say, moments of resistance that are therapeutically appropriate if you're working on something challenging. But I really think about the importance of being able to leave just for the reason that you've discussed, if something just feels off. And because the relationship is such a personal and intimate one, if there seems to be a violation perceived by the client, it's really important that they be able to at least step away and think about it or process it or say, you know, this doesn't feel right.
Well, therapists can have a lot of power. I mean, there's just a lot of emotional power. The connection that develops can feel very, very intense. And I think it's just important that clients always have autonomy and control. So, you know, because even if we don't want to necessarily exercise that power and influence, we do. And so trying to convince someone that they need to stay when they're clearly not comfortable, or having them sign up in advance for and pay for a block and then not be able to leave without, you know, forfeiting the money, that all seems like unethical practice to me.
And if you feel you can't say something within the therapeutic environment, well, something's gone wrong. That's something isn't working. And if you feel you can't raise that you're bothered about having to pay too much up front, or you're bothered about having to sign away what seems like a kind of an inappropriate scenario, well, then probably you're not going to feel very much therapeutic impact with that, because you're already feeling, I'm being scammed here on some level. I'm not really comfortable with it. And also, I don't really feel the freedom to be able to say it, because it would be fundamental to your therapeutic progress to be able to say, I don't feel comfortable.
Mm-hmm. Mm-hmm. We were talking in preparation for this conversation about the idea of do no harm. And so let's talk a little bit about what that means in the context of talk therapy. What do you two imagine about do no harm?
Well, that's the biggie, isn't it? And it's the thing more than anything that would make me feel so disappointed with myself if I have violated that. It's like, if I can do nothing else, don't harm. If I'm not much effective, I can live with it. But if I've harmed, if I've actually caused regress, and sadly, the science and the research suggests that bad therapy is a lot worse than no therapy, and therefore there isn't enough importance or emphasis placed on first do no harm. Because if there was, I think there'd be less people saying, an awful lot of people, let's be honest, an awful lot of people don't think much of our industry. An awful lot of people are saying, you know, I'm coming here, but I'm a bit annoyed. I've tried it before. I'm kind of stuck. My doctor's told me I have to come here, and I'm here, but really it hasn't worked before. Let's see what happens here. And I just think, wow, our industry hasn't covered itself in glory on a lot of levels. We have harmed, and history suggests we've harmed as well. We need to keep it in mind.
Mm-hmm.
Yeah, I mean, I think this one's hard. One of the things that comes up for me is the importance of not being sure, the importance of letting ourselves doubt. So, which can be unhelpful in its own right, but it takes me a long time before I can sort of recommend a certain path to a client. For example, let's say someone comes in and is wondering about leaving their relationship. You know, I mean, it's going to be a while. We're going to go through a lot together before I sort of say, you know, I think I'm really hearing that this feels right for you to leave your relationship. You know, because we can find ourselves deciding that we know what's best for the patient, and I don't think we ever really do. I think the patient knows what's right for the patient. So I think part of doing no harm is refers back to what I was saying before about the kind of power and authority that we can sometimes be invested with. We have to be very careful about that and make sure that we're not becoming identified with it, and therefore telling the patient what is right for him or her, landing on a diagnosis quickly and encouraging certain interventions, either in life or certain treatment options that might not be helpful.
Mm-hmm.
And if the client knows full well exactly what the therapist thinks they should do, perhaps that's not great. Perhaps it should be more you're feeling your way. I wrote a book about bullying, and I get a huge amount of pressure on me of, should I leave the school? Should I leave the school? Will I leave the school? Should I go to a new school? And, sometimes I might have opinions, but it's my job not to make it obvious what my opinion is, so that they can figure out, because I don't know what it is to be them, and I don't know what it is to be in their school. And it's such a big move, and it's a one that I battle with often because of bullying, because it's an obvious question. Will I just leave? And the parents, should they leave? And me going, well, we can discuss this, and I give a long-winded answer. And you can feel them going, what is she saying? Is she saying this?
Just tell me what to do.
Get to the point.
Yeah.
And that's our job, to hold that space and say, let's see if we can reflect on this without rushing to a quick solution, because life doesn't really work like that.
Mm-hmm. This is making me think about these kind of long drawn out processes of getting to know the client. And it's not linear. It's not like you spend X amount of months getting to know and then next, directing the, no, but I think about how there's this perception, I believe, that people will go to a psychiatrist or psychologist or therapist and have an assessment, an extended assessment, which is a bunch of paperwork and checklists. And while I think there can be some utility to doing that, it's not a substitute for taking the approach of, I don't really know what's going to come out of this, and giving it time to unfold slowly. And I think that's really the piece. It's hard when we are obsessed with creating a label for everything. Like, what would we put in a psychology textbook? Extended assessment, which is valuable, right? But it doesn't capture the kind of slow ambulating nature of how therapy often works when it's going well.
Yeah, I feel very strongly about this, because I think the world has kind of sold the psychology world, or the industry has sold this concept of diagnosis. People have jumped on it, and with diagnosis is the inherent promise of solution. So they chase diagnosis. And I'm on the way, I'm kind of a path on the way to getting the famous diagnosis. And when the diagnosis comes, everything's going to fit into place. And then I'll see them after the diagnosis has come, because I wouldn't be diagnosing. And you can feel this, oh my God, it's the same world. This whole promise of diagnosis. It's like, it's incredibly alluring, because it's so nice when you're in the middle of a horrible situation to think there's a path. There's assessments, there's tick lists, and then there's strategies. It's like, yeah, bring it on, lovely. And it's sadly a really, really simplistic and not a really helpful. I find myself, I would say, I'd nearly go as far as saying fighting back against it, certainly pushing back against this diagnosis world, because I really don't think it's helpful. I don't think it's helped. I think it has helped a small minority massively. And it's been a very big obstacle to proper therapy for a much larger group who didn't have as big a problem.
It has its place. I mean, for a number of years, I worked with war veterans with combat post-traumatic stress disorder, and the relief that someone felt in understanding that there was a reason for the suffering, that other people felt it too, that it had been observed, that it had been cataloged, that it had been studied, then you just feel less crazy. So there's definitely a place, but I think another thing that can happen with diagnoses, especially in this age where there's kind of massive concept creep around many of the diagnoses in the DSM, And Sasha, I know that both of you work with adolescents a lot. Adolescents are really looking to understand themselves. I remember when I was, a tween or a teen, doing those
The quizzes.
Quizzes.
I love them.
It's like, are you a Sagittarius? What does that mean or whatever? So, we're that's an age where we're struggling to understand ourselves. And if diagnosis is a way to do that, I mean, it might be helpful, but I think that there can be a tendency to land on it and then identify with it as if that is who we are. And it may not even be accurate. I mean, these kids doing these kind of self-diagnoses, I have some doubts about that, but I also just have a doubt about the utility of diagnosis in general when it becomes a way of cataloging the psyche. I mean, we're so complex, all of us. There's so many layers. We're so many different things, even in one day, and we're always growing and changing, always, especially when we're young. And to try to hammer down who we are into this one box with this checklist of symptoms seems like it really does a disservice. I think concretely what can happen is it can sort of become reified. It's like, I am depressed. And then it becomes the whole lens through which you understand your experience. And then things get kind of fixed and concretized and stuck, and it becomes harder to disidentify from depression and to think about yourself in new ways.
I'm aware too that over the last, let's say 50 years or so, there's been a push in medicine and in mental health to put more of the autonomy in the patient's hand, which I think overall is a positive trend. I mean, we have seen this kind of godlike status of physicians and clinicians trying to kind of get knocked down a few pegs, which I actually think is good. But I think what's happened is that we've kind of gotten on the upswing of that, and patients are, like you said, diagnosing themselves online. So rather than making the therapy more individualistically centered, where you're really working on that individual and their specific life circumstances and their experiences, you end up again putting them into this other category. So they not only are trying to take their mental health in their own hands, but they're still avoiding the individual work of talk therapy in some ways.
Well, yes, I think you're absolutely right. And it becomes a kind of consumer approach to mental health, which is not really what it's about. David Bell at the detransition event that was held in Manchester in November 2019, he talked about that, the kind of how mental health has become this kind of consumer-driven enterprise where the patient comes to us and tells us both what's wrong with them and then also what they want done about it. And, I guess we're just here to sort of do what they tell us to do. No, it doesn't work like that. He said, he had a great quote that was something like, therapy is talking to someone who's on your side but doesn't always take your side, or something like that. It was really lovely, because I think the point is the whole reason you go talk to someone is because they might see something a little differently than you see it.
And it's so amazing, as somebody who's trawled around therapists for years, when they do teach you something else and you go, oh, I hadn't thought of that. And everything opens up when that can be given to you. But this consumer thing is so tricky. It's so tricky because we are being paid. And it's such a tricky scenario that we have to accept. We are being paid. And not only that, a lot of people go to therapy and feel, I spent a lot of therapy and I'm not sure it made any difference. And so we have to respect that, and that makes us feel like we're on the back foot. And it takes confidence and experience to be able to take that and say, maybe you did spend time in therapy that didn't work, and maybe you are very unsure about continuing on, and maybe this does feel meandering, and I'm certainly not giving solutions, and yet I do have enough confidence in this process to hold that without throwing you a few solutions, which are clearly not only is somebody desperate to have, but also they've been told by culture and by society that they'll be out there. There's tactics and strategies and tips and behavioral kind of patterns that they can adjust and amend. And I think it's very unfortunate. It's the consumerist world that we're up against there. It's so big. And I heard David Bell speak about it, and he did it very well. But it's something that I prefer to throw it on the table and say, will we talk about this? Like, and get into it and unpick it and explore it. And let's pretend money isn't happening here. So, money's important.
Well, a dynamic that is a little bit different happens when you're working with teens because their parents are paying for their therapy. And oftentimes, as is developmentally appropriate, teens will want to come in and process familial dynamics and frustration that they have in the ways they're trying to individuate and their parents won't let them, or sometimes kids who are really wanting to basically crawl back into mom's womb sometimes and not grow up. And so there's a lot of different types of experiences, I think, that we have, Stella, as teen therapists. And I know that it can be challenging to, again, hold the teenager's frustration towards parents, but not allowing it to tip over into this ruminative anger at them, because of course we all were susceptible to that in our teenage years. And aside from cases where there's actual abuse and neglect going on, most teenage frustration towards parents is developmentally appropriate, but not necessarily accurate, right? So how do you work with that? Because I know it's a challenging aspect of working with teens.
With difficulty, and I find it, I find empathy goes a long way with it, but really the teenager wants to find out quite quickly when I'm working with them, are you with me, or are you with my parents? Which are you with? Come on, tell me your colors here. And that's where I kind of have to navigate, well, I'm actually with the most appropriate path. And I'm not sure anybody has it yet. And I try to go there and I try to say, well, will we discuss that? Because you'd rather I was with you. They'd rather that I was with them. I'm trying to be in the middle here, trying to navigate between the two. And this is difficult. And I hope I'm doing well. But I think it's the most helpful way to go. And like you said earlier, I think teenagers would respond to that. Because if I said I was just with them, they'd just be sham, fakery. They smell it at 100 yards. So I think authenticity is the most valuable thing I could bring to that. But it's not easy.
Mm-hmm. I sometimes face something kind of similar, even working with adults, because a lot of people come to me for difficulties in their relationship and they want to complain, let's say, about their spouse. And it's so easy to collude with that and just sort of, oh my God, he sounds awful, that kind of thing.
Yeah. And they do sometimes.
Well, and they do. And I mean, it's absolutely important that I validate what they're telling me and that I'm really with them and their feeling experience. But if all I do is just, session after session, month after month, say, yeah, he's really awful. Mm-hmm. All I'm doing is reinforcing what they already consciously know. And there's a way that when we're in therapy, we're hoping to learn something new. So it certainly wouldn't be my place to try to convince them that their husband wasn't awful or whatever.
And yet it's really difficult when you, as a therapist, you've got to know them, you've really explored the entire situation, and you come to the solution conclusion that actually this is really seriously dysfunctional.
Yeah. Yes.
And this isn't working. And this dynamic is all wrong. Now what we do?
Well, I think when you know that, you say that. But in the beginning, it's important to just create space and not just kind of double down on exactly every single thing the client is bringing in. Because even clients that come in wondering if they should leave the relationship, they're coming to see me because they don't know yet. Mm-hmm. So what they actually want is clarity. And clarity takes a long time.
Yeah.
So it requires walking around, just circumambulating the issue repeatedly, perhaps. And again, I think we said this before, but I see my job as let's hold space for this and see what wants to emerge. And then eventually, yeah, there's clarity. And, you know, I may hit the clarity around the same time the client does. Yeah, this is really not working. I'm really hearing you saying that this is not working. And then we're in a different place. So it's not that we never get there. But I think in terms of this ethical issue about rumination and joining with perhaps an adolescent or a young person in a way that's inappropriate, not joining, being with them, empathizing with them, but really colluding with them in seeing just a narrow slice of a particular issue without opening it up and experiencing different perspectives.
That's a time in life too when kids are really trying to differentiate between themselves and their parents. What I have noticed is that when clients come to the sessions with a lot of heat and energy around frustration, by spending some time not making any criticisms of parents, but validating the emotions, and things will unfold. What I often see happening is that eventually the client will connect that there are some things about themselves that really reminds them of their parents. They don't like that. So if you can hold it carefully, I think often you end up coming back around with some new reflections. And again, to go back to what we said earlier, it's not because the therapist is just making an interpretation right off the bat. It's a slow process, and the client has to come to those conclusions or realizations on their own. But I think when you do see a lot of heat around parents, again, the story is not always exactly how it presents to you. It's not always exactly the interpretation that the client has made, though you don't have to challenge the interpretation outright. It kind of unfolds on its own in that way.
I have heard of therapists just colluding right away with, let's say, a teenager's perspective on the parent. And that just seems like it's unhelpful, you know, except in cases of just clear-cut abuse or something.
I have too, and I have to say it seems really lazy therapy and really easy. It'll be easy to go, oh yeah, they're awful. Let's off we sail into all the wrongs that have been committed by your parents to you. It's so easy to collude. In general, in any relationship, colluding is often the easiest.
Path of least resistance.
Yeah. And you'll get buy-in immediately. You'll get contentment with the therapy. You'll get told you're a brilliant therapist. You'll get your validation very quickly, and you're not necessarily doing good work.
Well, this really reminds me of that godlike complex we were talking about earlier. I think for some types of therapies, and especially if you're working with a population that is in a great deal of distress, how tempting is it to be the only person who gets them? The only person who really is on their side.
It's really seductive.
Very, very.
And so many teenagers and older people, but so many people think they're the only person with this freakish feelings, that I'm the only one who could actually be feeling like this. And then if you get a therapist who's got a lot of power imbued in them, who says, yeah, I get you, then you can feel you're really in a really, really dangerously powerful position at that point. And it's a power that I think therapists need to be really wary of and make sure that they don't fall into this kind of, as I've heard you say, Sasha, the cult of two, that it's me and the therapist and the client. And
I like
else.
That. I don't think I said it, but I won't take credit because I don't think I said it. Because that's not ethical. But I like that, Stella. I don't know who said that.
It is great. It is really great.
A cult of two. There's nothing more powerful. It's so and that is something I think therapists need to be really wary of and keep on coming back into the bigger perspective.
Right, because then you're in this realm then of undue influence.
Yeah.
You know, this is really making me think about some thoughts I had when I was in graduate school and in my training, and I was aware that a lot of times therapists pursue careers because they have been through a powerful experience and they want to help people in a similar position. And even in grad school, that made me perk up a little bit, because I do wonder if there's a challenge in objectivity. If you are, like, let's say I had been in some sort of horrific car accident that wrecked my life, and I decided I wanted to help car accident victims. Is it hard to actually detach enough, not emotionally from the client, but from the complexity of it, from all of the personal experience you had around that issue, to properly help the person? And I think it can be done. I don't think it's impossible, but I am wary of that sometimes.
Right, as you should be, because I think that we can all fall into a crusader mentality. And I mean, that can happen even if we weren't the car accident, victim. We can attach ourselves to a particular issue and become over-identified with it. And then we're likely to have blind spots and to make errors. And that's always something to watch out for. And I mean, I can see that in myself at times, that I can get very impassioned about particular issues, and maybe sometimes not always have the most astute clinical judgment in those cases. But I do want to say, Sasha, I think you're lifting this up. I am a little wary, I think, of, for example, transgender therapists who only work on transgender issues. And the way that they can sometimes, I wonder sometimes if there can be some undue influence dynamics. Not that I don't think that a trans person could be an excellent therapist for someone who was either identifying as trans or wondering if he or she would be right to identify as trans. Absolutely. In fact, I know some excellent clinicians who are transgender who would help someone hold that space. But I think what we're just talking about is when that space collapses and we're in a position of like knowing what's right. And again, that can happen to any of us, myself included,
yes,
when we become over-identified or overly impassioned about a particular issue.
It's very like, and we've seen it, and it's been well studied, former addicts becoming counselors and treating addicts. And it has its place, and it's very valuable. And also, I would argue, and other therapists also have their place. I would say, the empathy and the connection is really powerful in rehab. To meet an addiction, a former addict, it's really, really powerful. And then I also think it's very powerful for people to say, yeah, and now we'll meet another therapist who hasn't been there and can bring you somewhere else. I suppose you can't stay in the same ground and walk over the same ground, because it's very, very easy to think there's only one solution. And it's definitely something that comes up, I think, within addicts and within, like you say, Lisa, the transgender treating only transgender, addicts treating only addicts. It just doesn't feel wide enough. It doesn't feel big enough for all the different ways to be an addict, for all the different ways to be transitioning.
In both of those cases, I think you end up with a one-size-fits-all approach to treatment. And that's exactly right.
What I did. Yeah. The addict often thinks what I did. Well, what I did is really important. You can't help it. Like, if you've been through a powerful experience and you've really brought yourself around, of course you're going to really identify with this. Sorry, I cut in on you.
No, that's okay. That's it. Just that whenever we have one singular perspective on how to help somebody with a specific presenting problem, like you said, Stella, it just misses all of the wide possibilities of how a person ended up in that position, and really sometimes neglects the holistic aspect of the person's life.
I have this image that sometimes occurs to me when I think about how therapy should feel, how I want it to feel for people, how it has often felt for me. And it's just sort of it's a very sort of sensory image. But, if you're in a sort of dark little room with a low ceiling, and then you suddenly find yourself transported into a cathedral. one of those kind of soaring European
Lovely.
cathedrals with the really high ceilings and the light coming in. And it's just so, you're just suddenly in a really big space. I think that is what I want people to feel.
That's brilliant.
I love that.
Yeah.
That's so great. And really, I mean, how much time does it take? And I think that's really important, to just lift up the way achieving that expansiveness takes time.
Mm-hmm. Mm-hmm.
Yeah.